Visit.
Well, we talked about this over the past week. We said how you know you and I and other practitioners have one goal in mind of what the treatment should be or what the treatment should entail and what we want to get out of the treatment. And
Mm-hmm.
obviously, the patient maybe might have a different goal.
Mm-hmm.
Like you said, even with my shoulder, I'm coming in complaining of shoulder pain on particular activity. In one sense, my goal is I don't want my shoulder to hurt when I do that activity.
Mm-hmm.
Your goal initially is, desensitizing my nervous system and neutralizing things and none of which might directly impact my immediate shoulder pain when I move my arm and do
Mm-hmm.
this thing. And it's the bridging of the gap,
That's right.
meeting somewhere with the patient where within that short amount of time they get some kind of relief or some kind of understanding of what we're both trying to do,
Yes.
and then it gets done.
That's right. And that is why it's really important to ask your patient what their goals are. If you do not ask the patient what they are hoping to get out of the treatment, then you're treading on dangerous ground. You must know what the patient is hoping to get out of the treatment. What is your ultimate goal? Because if they don't align, one of you is going to be disappointed. And it does not make for a good relationship, and it makes for poor medicine. It makes for poor rehabilitation outcomes, and you will waste time and energy where it will be misspent. So knowing what your patient goals are and being realistic about what you can deliver is very yeah, is a vital, and it is, and therefore you must also read the patient quite well. And that is why the history taking is important. It could be nice to try not to take the history from a physiological point of view and just examine the body and so on. But you're dealing with a human being and you're dealing with a complex personality. And so
Right.
the history taking is sometimes the most telling of how you're going to deal with this patient, not from a DNS point of view, but a human to human point of view, because they
Mm-hmm.
may tell you something about themselves or why they're there that sends out a yellow flag or red flag, and you realize that this whole problem has a lot more luggage going with it than it appeared in the first part. And if you're not careful, you're going to fail or you may end up in a lawsuit. So
Yeah.
it is really important that the history is taken and the inflections, the comments, the sentences, the asides, the apparent not important observations or viewpoints from your clients are all noted, because in the long run those might be the most important comments that you ever come across, and with that you will make decisions both for yourself and your client which are the most optimal.
Yeah.
Yeah.
Yeah. No, I mean, and just even on a basic practical level, I mean, at this point, I've been in practice for not as long as you, but for about 17 years. And, at this point, after I use the phrase desensitize, after I've desensitized the patient and their symptoms are reduced and things seem to be generally improving, at that point, I just outright ask them, listen, I specialize in physical therapy and rehab. I think the best way of moving forward is to introduce this and that, and this will mean that I'd like you to do some things at home, and it's going to mean that the visits here are not a shorter visit, but a more extended visit, and they're going to be involving exercises. Is this something that you think that you'd be willing to do? And Unfortunately, I mean, a lot of a lot of the patient population I see say, no, doc, I'm not gonna do it. I don't want to waste your time, so I'm not gonna do it. And then we just move on. Now, that might not make me the greatest practitioner, because some people might say, well, you need to educate them and teach them and tell them and show them that this is vital for their health. Now, at this point, I'm grizzled and old, and I'm not in the business of trying to sell them on, their own health. Not maybe the best practice, but that's just me. I give them my sales pitch, and if they don't take it, then they don't take it. But I guess, yeah, I mean, do you have anything to say about that in terms of almost like practice management? I mean,
Well,
because whenever I say that story, or I say that thing, and with those kinds of patients, usually it's apparent, like you said, it's apparent from the history, it's apparent during the little chit chat during the initial treatment and exam, that this is probably not the kind of patient that's going to be into the kind of treatment approach that I prefer. And often I'll think in my head, what would Robert do with this patient? Because I've rarely seen this kind of person or this kind of patient enter Robert's office where they're not willing to do things, or willing to spend the time, or in fact willing to spend the money for this kind of treatment. So what are your thoughts about this? What is your maybe practical advice? Ultimately, I think it's my fault, because that's the kind of patient population I'm attracting, and like I said, I'm not necessarily hard selling them too much on this approach.
I think that is really something, an important point. The patients who come to me are usually word of mouth, and so they already are pre-selected by people who have been through this process of treatment. They also, I do not, when they come initially and present, I kind of give them the overall viewpoint that, they see the DNS posters, they know I'm going to do exercise. I tell them that this is based on this movement, global movement pattern, and so on. So I do not give them the option of asking, is this something you'd like to do? I'm assuming you're coming here because you're going to be prepared to do this. So I think it is important that you already assume that they're going to do it, and not give them the, do you want to put your feet up and watch television? I can manage you with that, or we can do some exercise. I go, look, if you're here, it's because you're going to exercise. So if you're not interested, we're not even going to start this process.
You won't even give them the privilege of
well, it's not a privilege.
I know, I'm joking.
It's a waste of time. Yeah. The process involves exercise and movement, and I'm going to call you out on it on some stage. So either I can call you out now and you save your shekels and we part company and I can go watch television, or we know that at some stage you're going to do something, and I will be asking you in the future if you're doing it or not. Now, if you're lying, well, it's up to you, because, you're paying me. It's not as if it's free. And it will be on you,
Yeah.
So I think that it's important that you do not couch your questions in an option to or not, because if you do, these are the patients you will attract, because you're telling each patient that they have the option to not do anything that you ask of them. And so they go, well, hey, Dr. Bill doesn't mind if you don't do anything. You can go see him, he'll rack and crack you, because if you tell him you don't want to do it, he'll say, okay, and he'll let you go.
Yeah, I mean, well, that's definitely true. I mean, that's definitely the case. I think now that I'm hearing that and hearing what you're saying, I think part of it too, again, I don't want to make excuses for myself, because ultimately I believe it is obvious, it's all about me, my fault, or it's all about me. But I take insurance. I rarely have cash patients.
If you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.